All right. So let us begin with the developmental station first today, and subsequently we'll do other stations. Right. Okay. Are you able to see the screen share?
Yeah.
Okay. So do you want to read it?
Yes. A 2-year-old boy with history of delayed walking following bottom shuffling is referred to you by his GP for concerns about his gait. Take a focus history and do the motor milestones assessment.
Yeah. So take your 2 minutes for the preparation, and after that we will start.
Okay. And what about the names?
Yeah. 2-year-old boy, John.
Okay.
Okay. And father's name we can keep it Jacob.
Father's name?
Jacob.
Jacob. Okay.
Hmm. Just a minute. Yeah. Okay, let's begin then.
Yes, we can start. Okay, I'll start. Good evening. I'm Dr. Dinesh. I'm one of the pediatric doctors here. Am I talking to Jacob, father of John?
Yes, doctor, this is Jacob.
Okay. Is it the right time to talk to you?
Yeah, doctor.
Okay. What concerns are you having regarding John?
John is 2 years old now. I'm having concern for his gait and walking, doctor. Actually, he started walking late. Yeah.
At
So
what age he started walking?
he started walking just a month ago.
Okay.
Yeah.
Okay. And earlier he used to stand or he did not used to stand?
No, doctor, it is a delay only. It's always like late only. Even sitting also it was late and delayed, and standing also delayed. So he
Okay.
had bought, yeah.
And what about other things? Like he was always active, playful, or he was not active, just remaining to himself.
Uh, you can say, otherwise other areas he's okay. I don't have any other concerns. Not very active child. Yeah,
Okay.
yeah.
So when did he can he tell his name? Like if I ask him his name, so he can tell me his name.
So he can't tell his name. He will respond to his name.
He will respond. Okay.
Yeah,
But he
yeah.
won't be able to tell his
Tell,
name.
no, no.
Okay. And what about this thing? Like if I ask him to indicate what his body parts, so he will be able to do that?
Yes.
Okay. How many body parts he can tell?
Yeah, around 3 to 4, you can indicate.
Okay, around 3 to 4 body parts he can tell. And does he enjoy singing nursery rhymes or listening to them?
Yeah, definitely.
He sings them himself.
No, he doesn't sing, but he enjoys the nursery rhymes and he just tries to imitate her.
Okay. And what about other things like if you ask him to do something like put something on the table or that he will be able to do that?
Put on the table. What to put on the table? Like something, some.
Any toy or gift to like you or his mother so that he can do.
He can. If you ask him to bring something, he will bring.
Okay, he can bring.
Mhm.
Okay. Did he have any other problem related to his pee or poo, like passing urine or stools?
No, doctor. I don't have any issue, but we'll indicate about the toilet needs and about the pee. I don't have any issue.
He will indicate his toilet needs.
Yeah, yeah.
Okay. And he will play on his own or he will not play.
He will play on his own, and yeah, sometimes he will just try to go near the other kids. Yeah.
Okay. And he plays with others also?
No, but he will play alone, but not doesn't mingle with others. Yeah.
Okay, does not mingle with others. And
Hmm.
he can feed himself
Yeah, he can feed himself with the spoon. Yes.
with a spoon or with this thing, fork also.
With spoon, with the cup
With
and spoon.
spoon he can. Okay,
Hmm.
with cup and spoon. And what about his vision and hearing? Any issue regarding to that?
I don't have any issue for. I don't have any issue for that. Uh, any concern for that.
Okay.
He is okay. Yeah.
Uh, he can hear normally and he
Hmm.
did not have any vision problems.
Hmm.
Okay. Did any time he have any abnormal movements of his body, like in the form of seizures or fits?
I never noticed like that, doctor.
Okay. And any history of any head injury, like he had any significant fall?
Uh, Actually, when he started walking for last 1 month, he has slipped down twice or like, but he didn't bump head or anything like that. Yeah, yeah.
Otherwise, he did not have any injury to his
No,
head.
no, no,
And
no.
was he admitted at any time to any hospital for any illness, significant illness?
He had a chest infection when he was 1 year old, and yeah, he got better within few days.
How many days, for how many days he was admitted?
He was admitted for around 5 days.
Okay. So did they tell you what exactly he was having at that time?
They told some viral infection in the chest.
Okay. And when you notice that he's having a delay in his walking, so did you consult any GP or anyone for that?
Yeah, actually, I went to him around twice actually. Two times we went to him, and he told it can sometimes children might walk late, this, that he told. And second time when we insisted for the referral, then yeah, so he referred us.
So did he get any tests done?
No, we didn't do any test for sure.
He did not advise you to get any blood tests or any scans.
No, he told that doctor will see and they will decide if required, they will do it.
Okay. And
Hmm.
what about his weight? Like his weight is normal or his weight is less?
Mm. He's gaining weight. I don't have any concern for the weight.
Okay. And he started walking like you were saying just 1 month back. So when he has started walking, so how is he walking? Is he walking on his toes or is he walking normally?
No, no, no. Normally he's walking, and thing is that he's having little wide biscuit. Yeah.
Okay. Now I would like to ask you things about like when your wife was pregnant and delivered him. So at that time when she was pregnant, did she have any problem?
No, doctor, there was no problem.
She had any fever with rash over her body or her scans were done?
Yeah, there were no problems. All scans were done, and they told everything was all right.
Okay. And did she experience any reduced movement of the baby in her womb? Like sometimes it happens with the pregnancies.
I think one or twice it has happened, but we thought it could be because of some reasons. One time it has happened after taking some medication. So, but we went to obstetrician and got the ultrasound done. So things were all right actually. Baby was moving. Yeah.
Okay. And at that time, there were no other investigations done other than the jelly scan that is
Uh,
done.
no, they didn't advise any test that time.
Okay. And what about the delivery? How was he delivered? He was delivered normal or by cesarean section?
Yeah, so John was delivered by cesarean section.
And why was the cesarean done?
It was prolonged labor, and they told that something like fetal distress, something. Yeah.
Okay. And when the baby was delivered, John was crying like normal baby. He was handed over to you or was kept in nursery for some time?
No, no, no. He was not kept in nursery. He was handed over to us. He cried immediately after birth.
And he was delivered at full time, like full pregnancy time.
Yeah, yeah, he delivered at around the 38 weeks of gestation. Yeah.
Yeah, 38 weeks. Okay. After that, was there a test done at day 5 of age? Like the take heel prick test is done at day 5 of age. So that was done.
Yeah, yeah. Last 2 minutes left. Yeah, yeah, it was.
That was normal.
Yes, yes.
That was normal in that there was no problem.
No
And
problem.
after that, when he was in your house, so you did not face any problem with except for his gait and this thing.
No, no,
How
no.
many members are there in your family?
The total 4 members. Yeah.
Okay. And what do you do for earning?
Yeah, I'm working in a bank.
Okay, so the money that you earn is sufficient for all the family members.
Yes, 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 doctor.
And there is no other problem like in coping up with this illness or anything like that.
No, doctor. Actually, from my wife's side, I don't know. His brother had same, I think, delayed walking and something. When he was around the 20, 30 years, he died. I don't know what was the reason, but
Okay. So from your wife's brother, you are saying
yeah.
he had delayed voting and he died at what age? 20 years.
No, 28 years. When he was 28 years.
28 years. Okay. So did they tell at that time what he was having or anything like you have any idea?
No, nobody told us anything.
But in your family, you are not facing any financial problem or anything like that
No,
because of
no.
John's illness.
Mm,
Okay. And he has received all the vaccines.
Yes, yes.
Any vaccine that he has not received or any special extra vaccine he has received.
No extra vaccine received.
Okay. And what about his diet? Like he takes everything in your house, there is sun exposure is there, room is well ventilated.
Yeah, everything is all right.
Okay. And his
Okay,
food intake.
your time is over. Okay, could you please summarize your history?
Yes, today I had the opportunity of taking history from Jacob, who is the father of John, 2-year-old boy. Uh, Mr. Jacob has come with history of delayed walking. That child is not walking at a usual time, and he has just started walking around 1 month back. And he's giving history of delay in other motor milestones also. Like the child started sitting was also delayed, and otherwise there is no concern regarding his vision or hearing. And from his social milestones, I could make out that the child's age is around 1.5 to 2 years. He can feed with cup and spoon, and he cannot use fork. And from his speech and language, his hearing is seems to be normal, and he can respond but he cannot tell his name, and he can tell 3 to 4 body parts, which also puts his uh, this thing age to be around 1.5 to 2 years. So now I would, and there is no other significant history except there is one history. There are 4 members in the family, and they are not facing any financial problem. But there is a history of brother of the wife of the this thing, the Mr. Jacob. He had history of delayed walking, and he died prematurely. He died before time at the age of 28 years. Although the father is not completely aware of exact nature of his illness. Now I would like to do the examination of John. Can I proceed with the examination?
Proceed.
Okay. I will enter the room and I will wash my hands. And I would like to ask, what is John doing now?
John is sitting with the father.
Okay. Then I will collect my toys. The toys will be in the form of, I have to do motor assessment. So I will take a ball. I will take beads. I will take a board, and I will take this thing, crayon, cubes, and plastic scissors, cutting scissors.
Okay.
And then I will first see towards John and wave to him. Hello, John. How are you?
He's just looking at you, smiling.
He's smiling. Okay. And he's playing, or what is he doing? He's sitting or
He's just sitting with father.
okay. Now I would like to check his vision. First of all, I would like to check with the left eye and then with the right eye. So I will cover the other eye and check the second eye. So what about his vision? Can he see my fingers from a distance?
Yes, he can see.
Okay. And from both eyes, he can see the fingers.
Yes, he can see.
And if I give him a book to read, so he can see the letters in that and respond.
Yeah, he can identify.
Okay. So according to this, his vision is normal. And now I would proceed ahead with my other toys. I will take the crayon and give it to him. The crayon he holds with what hand? Okay. That means ki, around pencil glass. And is he able to scribble?
Yeah, a little bit. Okay, good.
Okay. Scribbling he can do. And he can draw this vertical line.
Mhm.
Okay. Now I would like to see with the cubes. How many cubes like he can use for making a tower? If I ask him to place one cube over the another, so how many cubes can he do?
Yeah, hardly two.
Okay, two cubes tower he can make. And can I will then ask the examiner ki whether I can give him the scissors to hold. So he can hold the scissors.
No, he's not.
And if I give him the book, so how many pages can he turn at a time?
Multiple pages at a time?
And he cannot turn a single page.
No.
Okay. And what about this thing? If I give him the beads, he will not be able to do these small. And a board, if I give, so he can this thing match two shapes, simple shapes like circle on the board.
No, he's just playing with that.
He's playing. Then I would like to proceed ahead with my examination and do the gross motor examination. In the gross motor examination, first of all, I would like to see his gait, how he is walking. So how is he walking? What about his gait?
Yeah, he's having wide base gait and he's doing wide, doing walking like this.
Okay. Wide base gait, and he's moving his both shoulders also up and down. Okay. And now I would like to examine him, and I would like to see his this thing lower limbs. Is there any hypertrophy of muscles of any side or anything like that?
Yeah, backside lower legs are looking a little bit prominent.
Okay. And if I ask him to run, so will he be able to do that?
No, no, he can't run.
Okay. And if I ask him, if I give him the ball, so what all can he do? Can he catch the ball?
He can't catch.
And he can kick the ball standing at one place?
No, he can't kick.
Okay. And next, I would like to do, I would like to ask John to lie down on the bed and stand up in front of me. So how does he stand up from the lying position?
Yeah, so he's just turning first to one side, then taking support and keeping his hand, thigh, and getting up.
Okay. Okay. And I would like to ask about his this thing. Any unusual dysmorphic features he's having, or he's connected to any device?
No dysmorphic features, not connected to any device.
Okay. And what about his growth dimensions? Like he's well grown for his age.
Yeah, weight is on 9 cm and height circumference normal.
And he's having any distinct distress, or is he normal?
Oh, yeah, he's normal, not just.
Not distressed. Okay. His eye examination is normal, like the color of his sclera and all.
Yes, 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 yes.
And when this thing, he cannot run. Okay. And upstairs, if I ask him to go upstairs, so will he be able to do that?
He can only travel upstairs.
Okay. How does he do that? He takes the support of the railing and
He travels.
crawls. Okay. He crawls over there.
Okay, so could you please summarize your findings in the assessment and what is your diagnosis here?
Yeah, today I had the opportunity to examine John, who is a 2-year-old child, who is not having any dysmorphic features, whose growth is normal according to the centiles, and he's not distressed. And on checking, his vision seems to be normal. And when I did his fine motor assessment, the child can scribble, he can draw a vertical line, and he can make a 2 cubes tower. So according to me, his age is around 1.5 years for fine motor examination, 1.5 to 2 years. And when I did his
Why
gross
2
motor
years?
exam, 1.5
Why?
years.
Okay.
1.5 years. And when I did his gross motor examination, in the case of gross motor examination, when I asked him to walk, his walking is wide-based gait, and his with the movement of his shoulders, most likely it is a waggling gait, and there is presence of the lower limb muscles hypertrophy, and on doing the gross motor examination, he cannot run, and he can
Which
walk
muscles?
upstairs.
Which muscle hypertrophy? Did you check for that? What muscles in the low?
In the leg, in the lower leg, the gastrocnemius, because the father was saying there is some hypertrophy of the muscles of the
Okay.
leg. And he can crawl over he can crawl upstairs, but he cannot otherwise go upstairs, and he cannot catch the ball or kick the ball. And when I did, after seeing the gate, when I did the Gower sign, so Gower sign was positive. And other systemic examination, like examination of the eye and other things, are normal. So on basis of gross motor examination, the age is around 1 year, 3 months, and there is presence of a waddling gait. So most likely diagnosis is a myopathy. And considering all the examination and history findings, my diagnosis most likely it will be a Duchenne's muscular dystrophy. And there's also a history of early death in the mother's father. So because this disease is X-linked, this thing, so usually males are involved, and sometimes we can get history like this. So first possibility will be Duchenne's muscular dystrophy, and second will be any other congenital myopathy, and third will be we can keep the possibility of any skeletal dysplasias, although other findings are not there corresponding to that.
What skeletal dysplasia you're thinking?
Achondroplasia will be there, but in that height will get affected, and we will get other findings. So it is unlikely. And
then if it is unlikely, why you're keeping that differential diagnosis?
Yes, that will not be there.
So okay,
we can keep the possibility of a.
Okay, all right. What is John having? Is he having isolated delay or a global developmental delay?
His delay is more in the motor milestones.
So it's right.
In the case of other milestones, there's not much of delay.
So is it isolated or global?
Isolated.
Okay, 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 okay. All right. So what could be the reason for the isolated motor delay over here?
Isolated motor delay is because of the condition, the genetic condition that he's most likely having, the Duchenne's muscular dystrophy that we are suspecting, which causes the problems in the muscles. And that is why he's not able to achieve the motor milestones, like
Okay.
walking is delayed.
How do you manage John now?
Management, first of all, I would like to examine him completely, do a full, complete musculoskeletal examination. And then after that, I would like to do routine investigation. I would like to do the investigations. In the investigations, I would like to do the serum CPK levels, which are usually high in this condition. And then I would like to do a dystrophin gene test. And if required, I would like to do a muscle biopsy later on, depending on the results of these two tests. And then we can get the levels of calcium, phosphorus, and alkaline phosphatase, although chances are less, but we have to keep the possibility of rickets also in this case. So I will get these tests done. And if my diagnosis comes out to be this Duchenne's muscular dystrophy, so the management will be in the form of a multidisciplinary team in which the members will be the uh, pediatrician and the orthopedics doctor will be there, the geneticist will be there, and in the paramedical there will be this physiotherapist will be there, and occupational therapist will be there, and then we may need the help of this thing dietitian, and here the child is small, so we don't need any this thing schooling help for schooling, and financially they are well off, so we don't need much of a social worker or any other person.
What is a cardiac complication they can have?
He can have cardiac complications. He can have cardiac complications in the form of cardiomyopathy, and in the form of arrhythmias can be there. And from a treatment point of view, I would like to start him on steroids.
Okay, all right. So your station is over.
Okay.